Hello, everyone, and welcome to today's edition of Wellbeing Live, hosted by the Mental Health Center of Denver and presented by Cigna, our sponsor. Wellbeing Live is a series of short virtual talks, workshops, and classes given by our experts from across the organization on topics to help support your well-being and the well-being of the people around you. My name is Amanda DeGruccio, and I work in the development office at the Mental Health Center of Denver. And today we are excited to hear from Erin Metz. Erin is a health educator from KIND, Kids in Need of Dentistry, and she will be talking with us today about oral health and nutrition. Very excited to hear about it. If you have a question during the presentation, please submit it in the Q&A chat in the upper right-hand corner of your screen. And from here, I'm going to go ahead and let Erin take it away.
Hi everyone, and thanks Amanda for that introduction. As she mentioned, I am the health educator at KIND, Kids in Need of Dentistry, and my role is to educate our clients, our patients, and our partners about how oral health impacts their whole body. So that's what we're going to be talking about today. Just as an additional bit of background for myself, I am also a dental hygienist, and I have a background in nutrition too. And so a little bit about today, we're going to be looking at how your mouth can affect several areas of your well-being, including your physical being and also some mental health in there as well. We're going to look at it in connection with how it affects kids and how it affects adults. And then towards the end of that, we will look at some brief tips on how you can take care of your mouth and how nutrition plays a role in that as well. So as we move to the next slide here, we are going to look at what a healthy mouth should consist of. And so a healthy mouth should be free of decay or cavities. I'll use those terms interchangeably. It should also be pink with healthy gum tissue. And if you see those pictures down at the bottom of the slide there, the picture on the left shows healthy gums. Those gums are nice and they're flat. They look very pink and healthy. If you look at the picture on the right side, that gum tissue would most likely bleed if you were to brush or floss it. You can see that it's more red and puffy. And then the final thing that we like a healthy mouth to have is to be free of pain. So as we move to the next slide here, I'm going to talk about some definitions that we use in dentistry. And these definitions are some of the diseases that we see in the mouth, but the first one is just more general. So inflammation in our body is our body's immune reaction to an irritant. So let me give you an example to maybe explain that better. If you think about getting a sliver in your finger, it can irritate that finger and maybe make it red or swollen or puffy. If it stays in there longer, it might make it itchy or warm. And that's just your body's way of saying this irritant, this sliver, doesn't belong in here, and we're going to try and get rid of it. Well, when we have oral health diseases, like gingivitis or periodontitis, which are the next definitions, those are also inflammatory reactions to irritants that are in our mouths. So gingivitis is an early stage of gum inflammation where gums can be puffy and they might bleed. But the key thing for gingivitis is that you can reverse it through good home care. So with your brushing and your flossing, and we'll talk about that a little bit later. And then the third definition I have for you is periodontitis, and this can also be known as periodontal disease. It's a more advanced form of gum inflammation, and it can cause bone loss around the teeth. So if you think about where your teeth are sitting in your mouths, the bone helps hold your teeth in there. Periodontitis can cause that bone loss, which might lead to tooth loss as well. You can also have puffy and bleeding gums. And one key thing about periodontal disease is you can stop it, but you can't reverse it. So it's better to catch these things early, such as in the stage of gingivitis. So I just want to, before we move to the next slide, give you just a little verbal content warning. I have some pictures of some cavities. So if that makes you a little squeamish or uncomfortable, please feel free to look away or close your eyes. and then I will let you know when we move on to the next slide. So with that being said, let's move to the next slide. And we're going to talk a little bit about what causes cavities. So we all have bacteria in our mouths. That's completely normal. We all have different types that are in our mouths, but when you add food to that mix, the food breaks down into sugar, and then the bacteria and the sugar create acid. And the acid is what weakens the tooth and causes decay. So if you're looking at the pictures, you can get decay on any surface of your tooth. So the top picture shows it along the gum line, and then the middle picture shows it in between the teeth, and the bottom picture shows it on one of the back teeth where you're chewing on the molars. So anywhere you have a tooth surface, you can get decay. So as we move to the next slide here, we're going to talk about what causes gum disease. And for those of you who had looked away, you're welcome to look back in, the pictures are gone. So similar to cavities and decay, bacteria and sugar again combine and they form plaque and acid. One way to think about plaque is if you've consumed food throughout the day and then you run your teeth or your tongue along your teeth, sometimes you can feel some soft material. Some people describe it as somewhat fuzzy, but you can remove it by brushing or flossing. That's what plaque is. And that plaque sits along the gum line and can irritate the gums. So like we talked about the sliver being an irritant, that's what plaque does. The acid also can irritate the gums. And then if the plaque sits there long enough, it can turn into tartar. And that's also called calculus, if you see on the slide there, which is basically hardened plaque. The plaque sat there long enough that the minerals in your saliva hardened it. And the only way that can be removed is by a dental professional. So since we've talked a little bit about the diseases that can happen in our mouths, we're going to switch gears on the next slide and move into how oral health impacts kids specifically. So when we're talking about this, we're looking at when kids have cavities or mouth pain, how that disrupts some of their well-being. So if we talk about sleeping first, if you guys have ever tried to go to sleep and you have a headache or you have joint pain, something's bothering you, it can be really hard to sleep. And then if you think about you have a lack of sleep now, the next day it might be hard to concentrate. And kiddos might fall asleep when they're trying to learn. So it can be extremely disruptive for kids to have cavities and mouth pain. The next part that can disrupt kiddos' well-being is through eating. If you think about chewing food and every time you were to bite down, if there's pain there, you're not going to want to eat. Also, cavities change the shape of your tooth and it makes it hard to chew sometimes. So when that occurs, kids aren't able to get enough energy from food to help them in their overall activities. And then those top two things play a role in the learning. And I have a couple statistics there for you. One of them is that 30% of missed school days in elementary students are due to dental problems. So that's quite a lot of missed school from oral health issues. The good thing is, through good home care, we can reduce that quite a bit. The second stat there just talks about grades. And kids who have dental pain are 4 times more likely to have poor grades. So all of these things kind of tend to go hand in hand and disrupt the well-being of our kiddos. So on the next slide here, we're going to look a little bit more closely into how mental health is impacted by oral health. So we talked about the sleeping and the eating, and when those are disrupted, it can negatively impact mood, and it can negatively impact the development of the brain as well. Sometimes kids with poor oral health might have different feelings, and I have some listed there. They might feel a little bit worthless or inferior. They could feel sad or depressed also. And sometimes those feelings can lead into how they react or interact with other kids and other people around them. And so they might seem more shy because they don't feel comfortable talking or they're worried about their mouths. Adolescents might seem more irritable towards others for the same reasons. And then the last little point there is about how mental health impacts oral health. So if someone is anxious or depressed or sad and they're more concerned with how they're feeling with their mood, they're less likely to take care of their mouths, which then leads to poor oral health, and then we get into kind of a vicious cycle of both impacting each other. So we're going to switch gears here a little bit more and move into adults. So on the next slide, we're going to talk about oral health and general physical well-being for adults. And if you recall, in the beginning, we talked about how periodontal disease is a state of inflammation. There's also certain types of bacteria that are present in periodontal disease. So the inflammation in the bacteria have been associated with other diseases. So the first one I have listed there is diabetes. And diabetes is also known to have inflammation associated with it. So if someone is a diabetic, they have an increased risk of having periodontal disease. If someone is a diabetic and has periodontal disease, it can be harder to control their blood sugar levels. And then also, diabetics are 2.2 times more likely to have dental decay. So it's important, if you do have diabetes, to make sure that your mouth is healthy. The next terms listed there are preterm and low birth weight. And these are for women who are pregnant. If you have poor oral health or periodontal disease during your pregnancy, your baby is at an increased risk of being born early, and it could also have a lower weight. So you could have one or the other or both of those. Again, it's important to have good oral health during pregnancy. The next one listed there is respiratory disease. And sometimes in periodontal disease, the bacteria that's there can be inhaled down into your lungs, and that can increase inflammation in people, especially who have asthma or COPD. So those two kind of tie together in that fashion. Also in respiratory diseases, there may be medications that are used that can cause dry mouth, and that might cause more problems with the mouth because we need our saliva to wash away the food and the acid to help reduce the risk for dental decay. And then finally, I have cardiovascular disease listed there. Those are different diseases of the heart disease. You might have heard of coronary artery disease. All of those things fit in there, and there is some association between periodontal disease and heart disease. We don't know the exact root of all of that, but it's still important to make sure you take care of your mouth to give you the best outcome if you have any one of these diseases. And so with that, we're going to move on to the next slide, and this one is going to talk about adults with mental health, just like we did with kiddos. And so adults who have periodontal disease have some moods that may be associated with that, and that includes stress and depression, anxiety and loneliness, and some of these can be similar as with the children. If you think about someone who might have a missing tooth, it can be hard to talk, and that might make them uncomfortable, and they might withdraw more from interactions with other people and make them lonely, and can lead to depression and other moods as well. Sometimes, like I mentioned with respiratory disease, there are different medications people might take with depression or anxiety that can cause dry mouth. And again, it's important that we have good saliva to prevent decay. And then again, just like with the kids, mental health impacts our oral care routines too. And so if you're depressed, it's just hard sometimes to take care of your whole body and your mouth. And so you again get into that vicious cycle of you have a lower mood, or your mouth is sore and bothering you, and they just kind of compound each other. So we've kind of talked a little bit about oral health diseases and how that impacts our bodies. So what can we do about that? So on the next slide, we're going to look at some key dental habits that will really help. And these are things that you can do at home without anybody else needing to be involved. So Brushing, it's important to do that once in the morning and once at night. During the day, you're eating food, so you're putting sugar on your teeth, and the bacteria are using that to create acid. So you're increasing the risk of getting decay if you're not brushing that off regularly. Also, throughout the night, our mouths do still create plaque, so it's a good idea to brush in the morning to kind of give your teeth a fresh start and have them be more protected throughout the day, especially when using a fluoridated toothpaste, because fluoride keeps our teeth strong. And then the second habit there is just flossing once per day. And this same reason as brushing, you want to remove any remnants of food or plaque or bacteria that are sitting in between your teeth. And these are areas where your toothbrush bristles are not going to be able to reach, so that's why it is important to floss. And I usually recommend this at night, just because again, you're eating throughout the day and you want to set that up well for when you go to bed. So then on the next slide here, we have one more dental habit that we'd like to talk about. And this is one that is important for you to go somewhere for. This is visiting the dentist. So we recommend that you visit the dentist every 6 months, kind of at a minimum. Sometimes people might have other concerns that they need to visit more frequently, but general rule of thumb is every 6 months. And the reason this is important is because they can look more closely in your mouth for anything that might be going on that you might not have noticed. And the other reason this is important is if you remember me talking about how that hardened plaque, the tartar, builds up, they need to be able to remove that as well. So those are 3 important dental habits that help keep your mouth healthy and lessen risks of some of those other diseases. So we're going to switch over to the nutrition portion here next. And so on the next slide, we will be talking mostly about sugary snacks and drinks, and we'll talk briefly about how they impact our well-being, our physical health, and then we'll move into the oral health part. So sugary snacks and drinks typically are very low in important vitamins and minerals and other nutrients that you need for a healthy body. They can increase your risk of unhealthy weight gain. A lot of times these sugary snacks and drinks are high in calories, but because they don't have very many vitamins and minerals, you don't feel very full, so you tend to overeat when you're eating a lot of these things. And then they can also increase your risk of getting type 2 diabetes and heart disease as well. And part of that is because of the risk of unhealthy weight gain, but these products are also inflammatory by nature, so they increase inflammation in your body, and they're just not as healthy. So on the next slide, we're going to talk about these sugary snacks and drinks as it relates to oral health. So as the name suggests, sugary snacks and drinks have sugar in them, and so they have quite a bit more than fruits and vegetables do. And so you're just generally at an increased risk of having decay or cavities in your mouth if you consume these a lot. Sticky snacks, such as candy, also stay on our teeth longer, and so that contributes to more sugar over time, which equals more acid. And then even if you're not having something that seems sweet or sticky to you, so for example, chips or fish crackers or other bread products, some of the things that you might find in a vending machine break down into sugar very quickly, even if they seem more salty. And they can still stick to the grooves in the backs of our teeth and increase our risk for decay. And then as far as drinks go, pop or soda, energy drinks, and sports drinks typically have a lot of sugar in them, but they also, some of them have acid in them. So not only are we putting more sugar on our teeth, we're also putting more acid on them. And again, that increases the risk of decay. And then sometimes with kiddos, they like to have a little snack before nap time or bedtime. And sometimes those kiddos who are younger might have a bottle when they go down for nap time or bedtime. And if anything is in that bottle besides water, it sits along the teeth and it increases the risk of decay. And those snacks can sit along those teeth, especially if they're not brushed off, and increase the risk for decay. So what can we do about nutrition to keep our mouths healthy? On the next slide, we're going to focus a little bit on drinks. And the general drink that I have of choice here is water. It's really important for you to drink water because your body, almost all of the functions that your body does requires water in some form. A general rule of thumb that I have listed on the slide is if you drink half your body weight in ounces. So for example, if someone were to weigh 100 pounds, you would just divide that by 2 and you would get 50. So they should drink about 50 ounces of water or 6 glasses of water a day. Now, given that we are in summer here in Colorado, it's pretty warm outside. And if you're exercising or working out, you lose more water. So it's important to drink more water. So that's just a general rule of thumb, but you might need to drink some more. Also, tap water is good for our teeth because it has fluoride in it. So it keeps our teeth strong and protects them against decay. And then, as I mentioned on the last slide, if you have a kiddo that goes to bed with a bottle, it should really only have water in it to help protect their teeth. So then on the next slide here, we're going to switch from drinks over onto some healthy snacks. And so we're going to look at just some little tips that you can do when you're looking to create a healthy snack. So the first recommendation I have is to eat fruit or vegetables for snacks. And an easy way to maybe do this is to have some sitting out on your counter. It's helpful to have it in sight so you're reminded about it and that you're not going around and looking for other snacks and maybe grabbing something that's not as healthy for your body or your mouth. A second tip I have is you might purchase some whole fruit or vegetables and then cut them up for easy eating throughout the week. You can pre-portion them so they're easy to grab if you need to grab and go something. And then sometimes I know kiddos are a little particular, especially if you're trying to cut up apple slices early and they turn a little bit brown. So just a little trick for that, if you add a little lemon juice or orange juice on there, it'll help keep them fresh a little bit longer and they're more likely to eat them. And then finally, more crunchy fruits and vegetables are less likely to stick to your teeth. And so that's just a good way to help naturally remove things from your teeth while you're eating. And sometimes kids, if they're eating, say, raisins or those craisins for snack, those are sticky too. And maybe combining those with a little bit of celery would be helpful to keep the mouth healthy and prevent decay. So that was a lot of information in a relatively short period of time, but we've kind of reached the end of my presentation. I have one slide left that I just wanted to provide for you, a dental resource. Again, I work at Kind, and if throughout this presentation you were thinking, man, I really need to get my kiddos into the dentist, here's our contact information if you need some resources and information. We have one clinic open in Commerce City, but we also partner with the Dahlia Campus for Health and Well-Being, which is part of the Mental Health Centers of Denver. So we have a clinic on that campus too. If you need more information to see if your kiddo is eligible for treatment at Kind, you feel free to call that number listed. It's 720-619-5333, or you can visit kindsmiles.org. And so with that, I thank you all for your attention, and I think we'll move over to the questions and have Amanda read some of those for us.
Hi, Erin. So we've gotten a few questions. Some of the questions that have come in, and this has me really wanting to brush my teeth now after hearing everything you said. What kind of toothpaste should I use? Someone asked.
So generally speaking, it's good to just use a toothpaste that has fluoride in it. One that's just very simple and basic is all you really need to use. Sometimes people ask, about whitening toothpaste. Whitening can cause sensitivity, so that's why I say just use a very basic plain toothpaste with fluoride in it.
All right. Another question we have here is, there are so many toothbrushes. How do I know what to pick?
That is a good question. And yes, you go down these aisles and you're like, oh my goodness. So a couple rules of thumb for that. Typically toothbrushes are going to have different age groups on them. So you want to match the age group to the person that you're buying the brush for. You also want to have a soft bristled toothbrush. Harder toothbrushes can harm our gums and our teeth. And they'll say on there if it's soft. Sometimes you'll say medium or hard, but stick with the soft. And then I guess one other thing I would say to that is if you have a kiddo, especially who has troubles with a gagging reflex, going for a smaller toothbrush can be more helpful. And so you can see the term compact on the toothbrushes, and that'll be a little bit smaller than the regular sizes. So that's what I would recommend to help guide you on your choices.
Excellent. All right, and moving right along here, we got a few more questions. I like to have soda, dessert, and some of the other things you mentioned, as do I. Can I still eat them? Is what they're saying.
Yes, and I will agree with that. I do like some of those things as well. I would say if you are looking at consuming some of those or eating them, it's better if you can eat them with a meal. Remember how I mentioned, chewing celery or eating celery when you have raisins to help get some of that off your teeth? If you're consuming soda or a dessert with a meal and you're eating other foods with it, it just washes it away better. I would also say when it comes especially to drinks like soda, it's better to drink that all at once so that you're not putting that sugar on your teeth throughout the day. So just drink it in one sitting to finish that. And then another little trick that I've used particularly for desserts is I like that, tasting something sweet at the end, but you might consider swapping some fruit for some of the packaged and processed desserts. You get a little bit more vitamins and minerals that way and more fiber. So it's just a little healthier, but you still get that little sweet spot at the end.
All right, great. And then these next two questions we have, I'll go ahead and ask at the same time. I feel like they're pretty related. We have someone asking for other suggestions on snacks, and then someone asking about canned or frozen fruits and vegetables.
So those are good questions. I think a couple other alternatives to snacks that pop in my mind are things like string cheese or raw unsalted nuts. Those are either pre-packaged or you can package them yourself, and they make easy to go snacks that are still pretty good for your teeth also. And then as far as canned and frozen go, if you need to use those to get fruits and vegetables, by all means do so. If you do not have fresh available, those are certainly okay to consume. I have a couple pointers to look for when you're buying them. If you look at canned fruit, a lot of times there will be added sugar in there. And like we talked about, added sugar is troublesome for our physical being and our mouths. So things like heavy fruit or heavy syrup indicate extra sugar in there. So look for ones that have either low or no added sugar. Sometimes the in-fruit juice, that term they use, has less sugar. And then canned vegetables are notorious for having lots of salt in them, which is unhealthy for our bodies. And so I would look at finding low or no salt added, particularly for the vegetables. And then when you're looking at frozen, it's kind of along the same lines, but sometimes they'll add sauces on there, like for the vegetables, and sometimes I've seen that with the fruit too. Extra sauces can add both more salt and sugar. So you want to look for just the plain fruit or just the plain vegetables when you're looking for frozen. But you can certainly get the vitamins and minerals that you need from some of the canned and frozen products as well. That was a good question as well.
All right, I think that's all the questions that we have right now. So We will adjourn here. Thank you, Erin, for joining us today. You're a valuable volunteer with the Mental Health Center of Denver at the Dahlia Campus Farms and Gardens, and we're so glad to have you working with our partner Kind as a health educator. This has been really valuable, and like I said, really want to brush my teeth now. So this was oral health and nutrition for those of us joining midway through, and thank you to everyone tuning in this afternoon for the latest edition of Wellbeing Live. Please share this series with friends and family, and if you're interested, fill out the form on the website to be notified of upcoming Wellbeing Live events and submit more questions. We look forward to having you join us next time for Wellbeing Live. Thank you.
Thank you.